Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And for the second straight week, I'm Dan's co-host, Anuja Madali. Today, we've got a festive episode as we celebrate 10 years of the patient portal and the impact it has made on Michigan medicine.
Now, before we dive into that, be sure you go back and get caught up on any episode of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, Google Play, or any other podcast hosting platform. You can also find episodes on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review.
On that note, let's bring in Dr. Margaret Punch and Adam Schneider. Can you please introduce yourself? And thank you for joining us.
Happy to be here. I'm Margaret Punch. I'm an obstetrician gynecologist at Michigan Medicine, and I've been involved in our MyChart journey since the very beginning, and was the medical director when we implemented the patient portal 10 years ago and have helped manage it since that time. I'm now an associate chief medical information officer, as well as the medical director of virtual care.
And thanks for including me. I'm Adam Schneider. I'm an application coordinator for the patient portal team, so I help configure the patient portal for our patients. I'm a nurse. I'm an RN background, and I'm a father of 3 children. One of them has a congenital heart defect that really got me into the portal.
Outstanding. Now let's start with you, Dr. Punch. When we say patient portal, can you explain what that actually is and what a patient can do online?
Sure. Well, it's both a web-based and an application-based access point to Michigan Medicine. So we have myuofmhealth.org, and there's also the MyChart app, which is also branded as My U of M Health, available in all the app stores. And patients can get an account for themselves or a proxy account for a family member in order to access lots of information about their care, their test results, and lots of other features and functions in the portal.
Why has it been so important for U of M Health to fully integrate the portal into our clinical care?
I think before, the only way that our patients had to get access to us was by phone, and that's really not the modern way to be in touch with people. We access information and care and appointments and all sorts of other things electronically in many different places in our lives now, and the portal gives us a way to do that through online access. And previously, the only way the patient actually got their test results was if we either called them to share those test results with them or mailed it through the U.S. Postal Service to get to them. And patients were often told, no news is good news. And if you get a test done and we don't call you, that means it was normal. But that isn't really the way that people want to have access to their health information. They want to see the numbers, see the results, and have access to that information in a timely and accurate fashion.
Yeah. So now, Adam, let's turn to you a little bit. Can you elaborate on what your experience has been like using the portal, especially when it comes to the care for your child?
Yeah, of course. So it's actually one of the reasons why I transitioned professionally into remote access and care in the patient portal aspect of what I do professionally. So it all started when my wife was expecting twins. During some routine testing, this is a shameless plug for the importance of routine prenatal care. But U of M actually was able to identify that one of the twins had a congenital heart defect. And when a child has a complex condition like a congenital heart defect, it's going to be a game changer for the entire family. My son he's going to require lifelong treatment, medical care, and medical follow-up. And the inpatients team, they did a phenomenal job, but it wasn't until I really got into going to all the follow-up appointments and all the different specialties that we went to. And that's when I was like, okay, what is this patient portal thing? I started, we downloaded it. I got proxy access to my children, and it was there. Then I realized how important that was to not only help me show up to the right building in the right time, at the right place, but also I was able to ask questions as I had them instead of writing them down and trying to remember when I see the physician in a few weeks. Because if you're anything like me, you're going to have this idea, this thought. If you don't write it down, you're going to have more ideas and thoughts, and you're going to forget it. So that experience really made me realize the importance of it and how well we were informed, and we were able to advocate for my son. We were able to like ask questions, but also like take a picture of this or that and say, does this look normal or is this not normal? Do we need to come in? And it gave us a lot of like ability to understand what is expected and just be well informed, and we were able to advocate for him. And I think because of the portal and because of the care that my son has received, he's definitely has outstanding outcomes and is doing really well because of it.
Yeah. So what would be your piece of advice to parents who maybe haven't fully embraced the portal?
So yeah, just simple, get signed up and get proxy access to your children today. Because when your child gets sick, the last thing you want to do is spend time doing that. You're going to want to have those lab results in front of you. You're going to want to have the x-rays or whatever happen, you know, if there's an accident or something, you can get that data in front of you, pull out your phone, you have the app, you have that access, and you have a question, you have a thing to look into, you can just be prepared for that. So I would say to any parents with children that are patients, get the access set up now, and then if you really need it, you'll already have it set up.
Yeah, and I would just add that even for parents of well children, you know, my kids were young before we had this kind of access, and if they needed to go to a camp and the camp wanted their immunization records, it was like a major hassle to figure out, you know, could I call the pediatrician's office and get it? Did I have a copy that was an up-to-date copy somewhere in a drawer in my cabinet? And parents can now access and print those immunization records any day, anytime. You know, so as I used to say, you can not be mother of the year a little more often or father of the year a little more often, because you can get them to the first day of camp because you have the copy of the immunization record.
Yeah.
And you can also ask for prescription refills. I think that's another great use. So a kid that needs an inhaler or an adult that needs their routine medication refilled, there's now an easy access point. And it's actually much easier for the doctor's office to refill those prescriptions when you send a request through the portal than it is if you call.
I know
it
that
links to the pharmacy, and it just is very seamless.
Yeah, I know for my medical care, I mean, I've asked more questions on the portal than ever in person, you know, because, and even if you're in the doctor's office, you know, at the time, a lot of times you're feeling anxious or stressed, and the questions aren't coming to you, right? And you're not quite sure what to do. But when you get home, you're like, oh, I should have asked about that. And I've sent follow-up questions, you know, and it's a lot easier.
But I think we also have to acknowledge, you know, that this also creates a burden for our care teams, because there is just an exponential growth in that kind of messaging.
Mm-hmm.
And so we're trying to balance sort of what's the acuity of those concerns and how that flows through to the care teams. We have it set up so that if when a patient sends a message to their provider, it actually goes through a nursing support team first. So if it's a simple question that the nurse can answer, then they can do that without bothering the provider, or provide, you know, guideline and protocol-based advice to the patient. And sometimes we just have to say it's risen to the level of the point where the patient needs an appointment, that it's too complex. And I think that's also where what's happened in the last 2+ years since the pandemic is an important transition as well, because now patients can do video visits through the portal. And so that gives us another way to more conveniently provide care to the patients using the patient portal, that we had our toe in the water, I would say, before COVID, and now we're you know, wading deeply in that space.
Yeah, we were happy to get somewhere around 500 video visits a month, and we're looking over 30,000 a month now.
Yes, I remember I've seen the improvement in the virtual care numbers as soon as the pandemic hit. Actually, you answered a couple of my follow-up questions that I had, which was, you know, what was it like before the portal and what was the impact on our providers? So thank you for covering those points. Dan, I'll hand it over to you to follow up.
Yeah, absolutely. So I think you talked about we have 30,000 virtual visits a day, but more generally
a month.
Sorry, yeah. So that would be a little crazy. So, but how many users a day do use our portal, whether it's for video visits or other things? And do you have other interesting statistics to share? I think it's
sure.
sort of fascinating.
So I don't know. I don't have the data on the number of users, but I can tell you about the number of logins. And so in March, we had 2.26 million logins. So if you asked per day, so that's about 73,000 logins per day. And we have over 800,000 patient accounts now. So we really are, before the pandemic, we were at about 50% of patients who we had seen in the last year who had an active portal account. And now we're at 73%. So the vast majority of our patients have access to this. And we're actually going live next month with something called My Chart Bedside, which is an inpatient version of the patient portal. So we'll be having tablets at the patient's bedside so that they can have similar access to their inpatient experience as they do currently with outpatient access. And then in terms of our video visits, the one statistic that people often like to hear is about how much miles of driving, as Gretchen Whitmer would call them, on those damn Michigan roads do we save. And the average video visit saves 67 miles of driving. And by the time you translate that into what we did in the fiscal year that ended last June, we were at over 28 million miles saved of driving. And we're already above 24 million miles since July 1st of this fiscal year.
Yeah, that's awesome. Well, thank you so much to both of you for joining us today and talking about the patient portal. If you want to learn more about the portal and its 10-year anniversary, go to mmheadlines.org. That's mmheadlines.org. All right, now it's time for the lightning round when one of our guests answers 4 quick fire questions. And Dr. Punch, you lost the coin flip earlier, so you're in the hot seat. Are you ready to go?
Ready.
All right. Who would you say has been your biggest mentor during your career?
Oh, that's hard to answer quickly. I'll say in the first part of my career, it was George Morley, who was a very senior obstetrician gynecologist. And then more recently, Dr. Timothy Johnson, who was my department chair for many years and recognized that I could thrive in administrative roles.
That's awesome. All right, now turning away from work, what is one book that you could read over and over again?
Oh gosh, my kids are such book readers. They're bookstagrammers, which is a thing now, apparently, talking about books on Instagram. I would probably have to pass on that one. I would like to watch Shawshank Redemption once a week.
There you go. You can change it to movies. I like that.
That's a fantastic movie to watch once a week. I would join you on that one. So this week, we're celebrating National Superhero Day. If you had a superpower, what would it be?
I would be able to deliver all babies vaginally and safely.
All right, now we're finally forecasted to have a week full of 60-degree weather next week. What's your favorite springtime activity?
Walking my dog.
Awesome. Thank you, Dr. Punch, for playing along with us and celebrating the 10-year anniversary of the patient portal at Michigan Medicine. If you want to learn more about the portal, go to mmheadlines.org. That's mmheadlines.org.
All right, and while you're there, you could check out other featured stories from this past week. For instance, faculty and staff were recognized for improving the patient experience. A video debuted sharing safety strategies in the workplace, and readers learned all about the Transplant Center in honor of Donate Life Month. Find all that and more at mmheadlines.org.
Okay, Dan, we learned all about employees impacting the patient experience earlier this week, as this is Patient Experience Week. What's one of the coolest things you've seen a colleague do just to make the patient experience better?
Yeah, so I joined in 2016. I joined Michigan Medicine, and one of my first experiences and major feature stories that I worked on in the Department of Communication was about one of our patient services associates, Eric Thomas. And what he would do is on his lunch break, he would go and play the piano in the CVC atrium. And not only did it improve the patient experience, I know that it improved the employee experience as well. Because, knowing the atrium there, you can hear it, on any floor that you're on in the CVC. And I was able to go and help film a video of it and listen to him playing, and just to see the people sort of gravitate toward him when he was playing, I thought was really one of the coolest things I'd ever seen. What about you?
Well, I haven't seen these events in person, but I've heard about a few weddings that we've had to host or hosted in the hospital while a family member was in a serious condition or near end of life. I know our teams have come together, setting up decorations, hairdressing and performing the wedding in the hospital room or near in the courtyard for our patients and families to have that experience. And I think that's so heartwarming.
Yeah, it really is. And people just sort of going above and beyond what their normal job description is, right? And I think that we see that time and again from people at Michigan Medicine. And I think it's really amazing. All right, it's time for the weekly trivia contest. Last week, we asked listeners, when was the first transplant performed at Michigan Medicine? The answer was 1974. Congratulations to loyal listener Brian Wu, who sent in the correct answer. Now for this week's question, here's Anuja.
This week's question is, the new video aimed at keeping employees safe was created as part of which program? Once again, the new video aimed at keeping employees safe was created as part of which program? You can find the answer in this week's headline story, and once you know it, send it to headlines@umich.edu for a chance to win a prize.
It's all the time we have for this week. Thank you to all of our guests for joining us today, and thanks, as always, to our listeners and viewers for everything you do for patients, families, and each other. We'll see you next week.